I would invite you to ask questions or give comments in the chat box or in the Q&A box. You can direct the question to someone in particular or to the whole panelists. And if you want your question to be private, you can also send it to me privately, and only me will see who is sending it. So let me briefly present our four speakers. We will first have Pauline Jones, Professor of Political Science at the University of Michigan, working on the impact of COVID-19 on popular attitudes in Central Asia. We will then have Sarah Wilson-Sucky, Associate Professor of Political Science at the University of Colorado, working on Russia's response to COVID-19, what Russians expect, what they get, and what they think about it. Then we will have Henry Hale, Professor of Political Science at George Washington University, presenting on the fear factor, how COVID-19 has hurt Putin and helped governor. And then we will have a group presentation on identity, COVID-19 and political support in Ukraine. That is a collective research with Volodymyr Kulik from the National Academy of Science in Ukraine, head research fellow at the Institute of Political and Ethnic Studies, working in collaboration with Olga Onur, associate professor in politics at the University of Manchester, and Gwendoline Sasse, director of the Center for East European and International Studies in Berlin, and Henry Hale is also part of that team. So without further ado, I would like to give the floor to Pauline to begin presenting her research. Pauline, the floor is yours.
Just thanking and acknowledging everyone at PONAR Eurasia for this opportunity to present research in progress. I also want to acknowledge my collaborators at the University of Michigan. This is the research I'm going to present today is part of a collaborative effort across many departments and schools at the University of Michigan graduate students. And so although I don't have time to acknowledge them individually, I wanted to, it's part of a much larger international research project called Studying International Coping and Compliance, or SIC for short, haha. And the idea is we surveyed via Qualtrics 20 different countries in 16 different languages. Some of the data I'm presenting is from that survey, but it's specific to Central Asia. And within Central Asia, I focused on Kazakhstan and Kyrgyzstan. Today, I'm going to focus on the popular attitudes, although we also look at the behaviors in the survey that we conducted. And the popular attitudes I'm going to focus on today are related to confidence and trust, because those are also related to legitimacy. I wanted to start with just sort of a background of why we would want to look at confidence and trust during crisis. One reason is that we think crisis has a huge effect on confidence and trust, and it can affect confidence and trust in both sort of positive and negative ways, right? Crisis can have a rally around the flag effect where confidence and trust, at least political confidence and trust, goes up, right? It rises because there's this rally around the flag effect. But it can also have a negative effect on political trust because people can lose confidence and trust, particularly if there's already a baseline low level of political trust in the government. We also care about confidence and trust during a crisis because the causal arrows go in both directions. Confidence and trust can either facilitate or undermine the government's ability to resolve a crisis. Why Kazakhstan and Kyrgyzstan within Central Asia? I think these are great comparative cases. First, because there's variation of regime type along this continuum of more authoritarian and more democratic, right? Neither are perfectly authoritarian or perfectly democratic, but they definitely vary along that continuum. And there's lots of research that says authoritarian regimes are better at dealing with crisis. Authoritarian regimes are more likely to have this rally around the flag effect when it comes to crisis impact on confidence and trust. And so they're good for comparison in that respect. They also have a great deal of variation in terms of state capacity, both financial or fiscal capacity and administrative capacity, with Kazakhstan, again, along a continuum being having greater state capacity and Kyrgyzstan having less state capacity. And interestingly enough, despite the variation capacity, they both had pretty similar COVID policy responses, at least early on in March and April. In fact, Kyrgyzstan very much followed in line with Kazakhstan, although Kazakhstan was out in front for sure by a couple of weeks in terms of instituting pretty strict social distancing policies, state of emergency lockdowns. They also both made, if I may say, the great mistake of lifting those restrictions too soon. And so they had similar results that by June and July, they were experiencing a huge spike in cases, not a second wave, but the result of not adequately dealing with the first wave or the wave. The method that I used for Kyrgyzstan and Kazakhstan was particularly, I did not use Qualtrics. I used rather phone surveys. I can talk about that in the Q&A if there are questions about it. We did 1,000 a random sample of 1,000 respondents with quotas for things like gender and age. And the dates were very much timed to these huge spikes in the number of cases in Kazakhstan and Kyrgyzstan. So early July, late June, early July. And we did multiple regions and cities within each country to vary sort of the impact, the number of cases. All of these regions and cities experienced lockdown. In Kazakhstan, north, south, east, west, obviously the capitals, Almaty and Nur-Sultan. And in Kyrgyzstan, both north and south, Bishkek, Chuy Oblast, Osh, and Jalalabad. So we asked a number of questions about confidence and trust. I'm only going to talk about a few because I only have 10 minutes. The question that we asked about confidence, really, how much confidence do you have in the following organizations or individuals handling of the coronavirus? So it's specific to how are they handling this crisis and how much confidence do you have? And respondents could respond a lot of confidence, some confidence, not very much or none at all. We asked about domestic individuals and institutions, the president of the respective countries, national as well as local health ministries, national and local governments, as well as national and local religious institutions and leaders. So we asked about the mufti, we also asked about local imams, local mullahs. And then for international institutions and individuals, we asked about the World Health Organization, the WHO, and we asked about the presidents of Russia, China, and the United States. Results look like. For Kazakhstani respondents, there was a very high level of confidence for most domestic and international institutions. So Kazakhstani respondents seem to be very confident across the board. Overall, the highest levels of confidence are in their own president. 75% have a lot of confidence or some confidence, right? 41% have a lot, 34% have some, but in terms of having confidence, 75% of the population has some or a lot of confidence in the president. Only 13% have no confidence at all. Statistically, the lowest confidence in terms of individuals and organizations handling the coronavirus was for national and local religious leaders. That was the lowest level of confidence. For international institutions, WHO, very high levels of confidence, almost as higher than national health ministries, although not much, and almost as high as for the president. But very low when it came to the presidents of China and the United States. Slightly lower for China, but pretty low for the United States. And I can talk about Russia if people are interested in a minute. It was higher than China and the United States, but not as high as you might think, and not related also to ethnicity, which I also thought was interesting. In Kyrgyzstan, respondents to this question indicated a very, very low level of confidence for most domestic and international institutions. So Kyrgyzstani respondents just seem to have a lower level of confidence across the board. Overall, exactly reverse of Kazakhstan, Kyrgyzstan respondents had the lowest levels of confidence in their own president. So 60% have not very much or none at all, 35% have no confidence at all, and only 15% have a lot of confidence. So it's almost exactly flipped from Kazakhstan to Kyrgyzstan. In terms of domestic institutions and individuals, the highest confidence was in their national and local religious leaders. And again, it's something I can say more about. This is highly correlated with the degree of religiosity. Internationally, again, very high confidence in the WHO, higher than their own national ministry, but lowest for the presidents of China and the United States. This is a repeated pattern, by the way, across the 20 countries that we look at in the larger study. It's not just Kazakhstan and Kyrgyzstan. In terms of trust, again, we asked a number of questions. We asked questions about general trust, interpersonal trust, political trust, but I thought I'd focus on this one. How much do you agree with the following statements about the coronavirus, COVID-19? They were asked whether their government was underreporting the number of cases or over-reporting the number of cases, right? So how much trust and confidence do you have in these numbers or the reporting, the accuracy of the information that the government is giving you? And respondents could strongly agree, somewhat disagree, or strongly disagree. Again, you have a complete inverse in terms of what Kazakhstani respondents and Kyrgyzstani respondents are saying. When it comes to underreporting the number of cases, the majority of Kazakhstani respondents agree that the number is higher than what's being reported. 55% think it's higher, so the government is underreporting. In Kyrgyzstan, the majority actually disagree that the number is higher than reported, right? So 58%. When it comes to over-reporting, and this is consistent with sort of if you're the majority are going to say they're under-reporting, the majority should also disagree that they're over-reporting. So it's nice to see these results are consistent. Kazakhstanis the majority think that the government is not over-reporting. They disagree that the number is lower than reported. That's 57%. Whereas Kyrgyzstan respondents, the majority were more likely to agree with the statement that my government is over-reporting the number of cases, 65%. Higher. What does this all mean? How do we interpret this? So one interpretation, and I'm open to comments and criticism and suggestions, but one interpretation of just the data that I presented today is that Kazakhstani respondents think the crisis is worse than the government is telling them, but they have confidence in the government, specifically their president, to handle the crisis. Whereas in Kyrgyzstan, the respondents think the crisis is not as severe as the government is telling them. And they have very little confidence in the government, specifically their president, to handle the crisis. I think this has huge implications for compliance with mitigation policies. That's what I'm planning on looking at next. But again, as I talked about more toward the beginning of the presentation, how much individuals believe their governments, trust in their governments, they're giving them the accurate information and that they're able to handle the crisis is going to affect the degree to which they adopt the behavioral mitigation policies that the government is recommending. Thank you.
Wonderful, Pauline. Thank you so much. Let's move to Sarah. And I invite people to begin asking questions in the chat or the Q&A box, and I will kind of compile them and moderate them after. Sarah, the floor is yours.
Oh, good. I'm unmuted. I think Madeline did that for me. Thank you. So I don't think I'm going to say anything that's really going to shock anyone today, but what I've been interested in is Russians' responses to the COVID crisis. And so what I'm looking at here is what Russians expect, what they're getting, and then what they think about it. And so to start with, I have these three questions. What do they expect? And I have an original survey question, a series of original survey questions from February of 2020. So before the pandemic began or the response to it began in Russia, that Russians generally have low expectations for medical care. And then what have they gotten in response to it? This is, maybe it depends on your perspective somewhat. There's a varied response across regions. There are a lot of people at least claiming that there might be misleading information and downplaying the risk and severity of the crisis. There's a number of news stories about governors of regions or doctors or other officials raising red flags that perhaps the government is not doing a good enough job and is not, and that numbers are actually higher, and then things happening to those people. There are at least reports of that. And then we see an early release of the Sputnik 5 vaccine, and early meaning it hasn't gone through the phase 3 trials. And then what do Russians think about this? And what we know from the survey data that's coming out, from published survey data from Levada right now, is that a lot of Russians are mostly okay with the Russians' response, or at least in the way the questions are being asked right now about their approval of it. And so if we look at sort of what do Russians expect, what is their kind of baseline expectation for what they think that the state will actually provide? And that's distinct from what they think the state maybe should provide, but that this is what they expect the government to be providing. And so what we see is that for healthcare and polyclinics there, which are the two that are most relevant for this presentation, is that their expectations for a lot of Russians are low. And this breaks down differently if we were to break it out by urban and rural differences, of course. And if we looked at different regions, there would be variation in this. But what we see here is that if you are just looking at those bars for healthcare, and we say, to what extent does the government provide adequate services in these different areas? And you look at healthcare, it's well over 60% say somewhat not or definitely not, that the government's providing adequate services. The approval of, or the extent to which people think there's adequate services provided by the polyclinics is a little bit higher, but it's still more than 50% of people saying that the polyclinics are not providing adequate services. And so there's a lot of skepticism about what the government will actually provide. Now, if you ask Russians what the state should provide, the answer is likely to be very different, that they think in principle the state and the government should be providing better services. But what they actually, if they actually think the government is currently providing them, a high number would say that these are not adequate services. And so if we look at what Russians have gotten in response to the COVID crisis, this is not a sort of perfect match with the question of they're skeptical about the quality of whether or not they get adequate services currently in healthcare and in polyclinics, and then what they've gotten in response to COVID. It's not a sort of a perfect match between those questions, but what they've gotten has been in some ways similar to other countries and in some ways not. So in February, Russia started restricting the entry of Chinese into Russia when this was being sort of primarily portrayed as a crisis or illness that was originating in China. In March to mid-April, we started to see that there were these sort of holidays or non-working periods, they were called. There were closures of some public places and buildings. And then we see a lockdown in Moscow that's relatively strict compared to the rest of the country. In April, Moscow puts in place a digital pass system. So they'd had a more strict lockdown, then they had this digital pass system that you had to download on your phone or otherwise have like a printout of this digital pass to do things like go to the store and go outside. Moscow announced the building of temporary hospitals, something on the order of like 44 hospitals were announced to be built as temporary hospitals. And the news we see coming out at this time in March and April from Sobyanin, the mayor of Moscow, is continually like, we might have to continue the lockdown. This is going to be very serious for a while. But then we see in June, they start lifting the restrictions in Moscow, including the digital pass system. And Sobyanin says it'll take them about 2 months to fully lift the restrictions. But it's not long after that. It's in July that we see they announced the completion of clinical trials of a vaccine, the Sputnik 5 vaccine. They announced that schools will open, which schools have opened with no special precautions, with no mask wearing, no social distancing. So there's this real shift from in March and April, the language of people like the mayor of Moscow, Sobyanin, saying this is serious, we're going to need to hunker down for a while. We may have the lockdown in place until we get a vaccine, to they've opened the schools and they've started lifting the restrictions. In August, it was in mid-August, they announced that the Sputnik 5 vaccine, they would have mass production. They would start vaccinating maybe in the fall. They're going to sell something like 100 million doses to India is the current announcement. Sobyanin has gotten the vaccine. Putin's daughter has allegedly gotten the vaccine, and some other people. But what we're seeing most recently reported, at least, is that nearly 50% of Russians say they will never get the COVID-19 vaccine. So there's a disjunct between the state claiming we have this great vaccine and we'll vaccinate people and that's great and we can lift the lockdown, things are getting better, and half of Russians saying they will never ever get a COVID-19 vaccine. We can look at the numbers too that are the official numbers reported, and this is what's been reported, is compiled rather in the Moscow Times. Russia has over 1 million infections total that are official for the COVID pandemic. There are a number of people saying that they're skeptical about official numbers and that if you compare average deaths on a month-to-month basis, the average deaths now are much higher and suggest that the COVID numbers and COVID deaths may be much higher. Judith Twigg has pointed this out as well, that we will eventually know what the real numbers are because you can compare the death rates, and especially pneumonia death rates are indicative that the numbers might be much higher. And so we see that from when Moscow canceled the quarantine in early June to now, the numbers went down slightly, but have stayed steady really since the end of July, at least for COVID. So arguably not the best response, and arguably lifting restrictions far too early. So then we have the question of what Russians think about this. And this might sort of fit nicely following on Pauline's presentation, that we know that Russians are skeptical about official information on COVID, and that's not new to anyone, I think probably attending this panel, that Russians are skeptical about official information. But what you'll see is that the highest response category, and this is from late spring, early summer of 2020 of this year, the highest category is they only partially trust official information, which fits really well with what we know about already, sort of how Russians consume news, that they think there's some truth in it and they can kind of decipher what's true and decipher what's not true from this. And so that only partially trust category is the highest and goes up a little bit during this time period. This is May to June. So not a huge time period that we're looking at, but this is in May and then in June, that we see a slight increase in the only partially trust. The absolutely do not trust, though, is not a negligible category at about a quarter of respondents are saying they absolutely do not trust official information. And the people who fully trust is a very small percentage of respondents. So we know that Russians are skeptical, that they're getting the full picture from the government, from the media. And then we should think about what they think about the government's response. So if we look at their fear of contracting COVID-19, if we look from February to July, what we see is that the people who are saying definitely yes and probably yes, which is that solid line and the dashed line, the blue and the red, the solid and the dashed line, it's the highest in April, and then it's gone down slightly by July, so that it looks like Russians became pretty worried about it, and then that concern has decreased, right? So that Russians, at least according to this question, it looks like Russians are slightly less concerned about contracting COVID. What I think is interesting as well is Russians going back to work in person, which, I mean, there's a huge number of respondents here. You can see there's no change in their work situation between April and July. So 70% of respondents, that stays the same when the survey is done in April and July. But if we look at the number of people working at home, we see a decrease in the number of people working at home from 80% of respondents from 8% of respondents to 7% of respondents. People, which is not a huge number by any means, even at the height of the quarantine. People who are fully remote, there's a bigger drop from 13% to 5% there. And then people on leave, we can see too, it was never a huge number. People on leave with pay went from 8% down to less than 2%. So what we do see is that, so Russians appear to be less concerned about contracting COVID, and they appear to be going to work more, the people who were working more at home or fully remotely. And so it's also notable that there's really high approval of Putin's COVID response. And I'm getting close to, I think, my 10-minute limit, so I won't spend a lot of time on this. But more than 60% completely or somewhat approve of Putin's handling of the COVID crisis. So a pretty high approval rating for Putin's COVID response. Now, that leaves a not negligible number of Russians, between 30 and 40%, that do not approve, that somewhat disapprove or completely disapprove. So I think an area for future exploration is to see where that divide happens, why you would approve of Putin's response or not. And if you break this down, we can see that in urban areas, the approval rating is lower. And then, so we can see regional leaders, this is largely the same, actually, that people approve of how regional leaders have responded to COVID as well, which is interesting in that Russians don't trust the state to give them the accurate information. So this is what reminds me of Pauline's presentation a bit. They don't trust the official story, but they're okay with the response. And there's this difference here between us. So there's something really interesting going on there, I think. What I conclude from this very preliminarily right now is that many Russians, not all, but many did not expect very much. They didn't really get very much in response to the COVID crisis, and many of them are all right with that. So that it's not that the Russian government did a great job, it's that Russians' expectations were pretty low and the government did enough. And they're distrustful of official information. So I'll stop there. Thank you very much.
Thank you so much, Sarah. And that's a great transition to Henry's presentation. Sorry, I hear my voice in a kind of echo. So yeah, wonderful transition to Henry's presentation. Henry, the floor is yours.
Okay, thank you. Can everyone see it?
Yeah, can you make it, yeah.
Yeah.
Perfect.
Okay, yeah, so thank you. I think my talk here follows on pretty nicely with the other two really interesting presentations. What I'm interested in primarily is whether strategies like Vladimir Putin's, which was to essentially shift responsibility to a significant degree for handling the response to regional leaders, winds up being a positive for the regime or a negative. So as we know, in April 2020, Putin was very clear that he was giving substantially more powers to the governors to decide based on their own region's specifics how to respond, and he tried to make clear that, well, they're going to be held accountable, that this was a grave responsibility. And at the same time, as Sarah mentioned, we've looking at Putin's approval pattern has been one often draws the conclusion that his approval ratings have been slipping because of COVID, because we see kind of a slight decline in his approval ratings over the last several months. But at the same time, I don't think we could just leap to the assumption that it's hurting him, because his popularity was declining for other reasons as well before that. And so what I wanted to do was to try to see if we could find a way to isolate the effect of the pandemic and specifically different aspects of the pandemic on Putin's political support. And so the method that I chose for this particular study was through a survey experiment, which I'll describe in a moment. And the basic finding is that indeed efforts to evade pandemic accountability have backfired politically in a number of interesting ways, and also maybe backfiring in terms of the actual health behaviors of Russians. All right, okay. The data here come from a Levada Center survey. So I basically included a set of questions on Levada's omnibus survey, which was taken in late April of 2020. So early on in the pandemic. The survey as a whole included, as Levada's omnibus surveys usually do, about 1,600 respondents. So you have a good deal of enough respondents to really kind of sort out some of the complicated issues here. So a first question that I was interested in was, what do people think Putin's priorities are for the virus? So let's see, just a minute. Okay, yeah. And so I asked them whether they thought that the key priority was stopping the virus, regardless of economic consequences, or whether what he was primarily trying to do was to combat the virus, but also while saving the economy. So whether his priority was basically, the virus or the economy. And as we can see, the results seem to be pretty mixed. People didn't have a clear position of where he stood on this issue. So some people thought he was prioritizing the virus. Some people thought he was prioritizing the economy. There are a good number that found it hard to say. And I think this, in the end, has some important consequences. Let's see here. So in order to try to sort out what the pandemic is doing, I embedded an experiment in the Levada survey. and basically randomly divided the respondents here into 4 groups. I used almost all the respondents, not all of them, because I was interested in a different question in the 5th group. But the 4 groups that are roughly of equal size, a little over 300 people, 3 out of the 4, that is all but a control group, were asked a question which was designed to get them to think about different aspects or different ways in which the COVID-19 pandemic might be experienced that might be linked to regime support. So one asked them about to think about how state officials are battling COVID-19. That's the performance indicator. A second asked them to think about known individuals that were may or may not have been infected. So people that they know about who have been infected, right? So that's kind of the personal aspect of the virus. And then I asked them another group to think about the economic consequences of the virus. And so the idea is then that everybody, after getting that question, is asked about how much they trust Putin, and also whether they want to keep him in power beyond the year 2024. And so the basic idea here is that if even just getting this modest kind of treatment, being asked a question about, say, the economic consequences of the pandemic, creates a substantially different pattern of answers to questions on Putin's trust, then we have a pretty good indication that that consideration, like the economic consideration, is actually influencing Putin's trust. And so this is a way of kind of sorting out how the virus and how the pandemic crisis is impacting Putin's popularity, not only looking at whether it does or does not have a positive or negative impact. So the results on whether people trust Putin and whether they want to keep him beyond 2024 as president are about the same. So in what follows, for the sake of simplicity, I'll just focus on the results having to do with the trust in Putin. So this slide presents the aggregate figures, which show that on the whole, there's not a huge difference between the treatment groups and the control. This is when all the population is lumped together. Although on balance, you can see that the effects of the people in the treatment groups, right? The treatment groups are the ones who are reminded of some aspect of COVID-19, report lower trust in Putin than do people in the control groups. So you'll see the y-axis is whether or not people trust Putin, basically the likelihood that they'll respond that they trust Putin on the whole, and the x-axis is the difference between the control group and the treatment group, and the dot is the estimate of the likelihood in each group. So you can see in the far right graph is kind of overall. If we combine all of the COVID-19 treatment groups, we see there's a slight difference and it's negative. But at the same time, the whiskers going out of the dots are 95% confidence intervals, which tells us that these differences are not statistically significant. But this is at the aggregate level. So it's very important, I found, to disaggregate the different parts of the population. And what I found is that the aggregate figures hide what might be called a virus fear divide. So if you divide the people up into people who in a separate question responded that they tended to fear the virus and those that tended not to fear the virus, what you see is in particular on the far right-hand graph that's circled, this is the most pronounced effect, that among people who do fear the virus, there's really no effect of being primed on the economic aspects of the COVID crisis. But Putin is being punished pretty severely among people who do not fear the virus. So these are people effectively who are very concerned that this whole thing is destroying the economy, and they're punishing Putin for that. And they don't think that they think that the virus isn't really that serious of a threat, and so they would rather a stronger focus on the economy. And beyond this, there's really no variation by different risk groups, older, younger people. Doesn't vary by how severe the pandemic is in different regions, et cetera, or what policies the regions, the governors implemented. And the other thing that I find is really interesting is that while Putin is reaping the punishment for the economy, the governors are reaping the political benefits for performance. So when people are asked a question to get them to think about how their officials have responded in terms of concrete actions, state policies towards the virus, Putin's ratings don't go up, but governors do go up substantially. So it's the governors that are reaping the rewards. And the governors also, interestingly, are not being punished on the basis of the economy here. As you can see in the third graph from the left. So governors' performance dividends are slightly more pronounced among people who do fear the virus. So there seems a weak basis for the claim that Putin is being punished by the people who don't fear it, and the people who do fear it want governors to take actions. But at the same time, also governors tend to do better in terms of support when they're implementing lax COVID policies. And this is even controlling for the severity of the crisis in their region. Men seem to be more likely to rally around the governor, and highly educated people do as well. So just in conclusion, a few takeaways, which are, first of all, about the consequences of authoritarian efforts to shed pandemic responsibility. One consequence seems to be that people become unclear of where the leader stands. And at the same time, this doesn't get the leader off the hook politically, because the leader, in this case Putin, could not escape punishment for the pandemic's economic effects, and he's being punished specifically by people who don't fear the virus. And we also find that the performance benefits goes to whomever the power is delegated by the central leader. And in a separate study, I've actually found that this ambiguity at the central level can cause worse health behavior on the part of individuals. And so the final thing that I would highlight just before signing off is I think this also reveals the importance of this fear divide that Sarah was talking about as a kind of political cleavage, at least during the time of the pandemic, at least early on in its spread. So we'll have to track this later to see how things develop. So let me wrap up there, and I look forward to the rest of the discussion and your feedback. Thanks.
Thank you so much. I now would like to give the floor to Volodymyr, who will be presenting the collective research, but Gwendoline is here too to participate in the Q&A session, and Henry is also part of that second team. So Volodymyr, the floor is yours.
Yeah, thank you, Marlene. I'm glad to see that Ponar's Eurasia is fully alive and virtually kicking. And what I'm presenting for our team is very much similar to what Henry just presented. So it's very fortunate that I'm presenting right after him. It's not that we discuss the two studies kind of in a tandem. Henry did that fully on his own. But the design is rather similar, so I can use much of what he explained and just save time. We differ from Henry's focus in that we also, in addition to asking about how Ponar's affects support for the president, in our case, approval rating, we are interested also in the impact of different identities. Ukraine is often perceived as a kind of diverse ethnoculturally, linguistically society with identity divides being politically manipulable. So we try to see how this identity device feature, how they perform actually in the situation of a perceived threat to national collectivity. So literature said that strong identities can structure influence, but the influences on political performance and political trust and support. We wonder if they do so for pandemics, and if so, in which way. So early literature kind of paints a mixed picture. There is evidence, for example, from Canada that this COVID-19 acts as a rally around the flag event when the nation becomes united in its response to the threat. But there are also other studies arguing that COVID exacerbates identity differences and exclusionary tendencies in many societies. So people start looking for whom to blame. So scapegoating usually leads to minorities and migrants and other vulnerable groups. So we want to contribute to looking for this answer, whether it is a rally around the flag or greater divides, by a survey experiment in Ukraine, pretty similar to what Henry presented for Russia, but with one significant addition. Specifically focusing on national identity. So our main finding is that it is a rally event, but what we call a reverse rally event, namely people are united, but not in support for the leader, but in withholding support for the leader. So we rely on a nationwide representative survey in Ukraine around the same dates as Henry did in Russia, and late April, pretty early in the pandemic. 2,000 respondents, phone interviews, face-to-face was pretty low at that time because of a national lockdown. So we also embedded experiment in the omnibus survey. We have 5 groups, 1 control group and 4 treatment groups. So which similar to Henry's pertain to different ways in which people experience this COVID. Similar to Henry's personal, known individuals infected leadership, think of how Ukrainian leadership responded to the pandemic, economic, how the economy was affected by the pandemic, but also what we call a nation treatment. So think of our people who have been infected. We are rather vague intentionally about our people. So we, in the context of the first sentence, which is, as you know, Ukraine is now facing the novel coronavirus. Mentioning Ukraine is the first sentence. Everything that goes after that is likely to be perceived in national terms. So our people would mean Ukrainians, but we are vague about what exactly that would mean. Ethnically, territorially, all Ukrainians around the world, Ukrainians within Ukraine, and so on. So that vagueness kind of allows us to look more closely at how national prime affects that approval rating for the President Zelensky without dictating what kind of nation people should think about. So aggregate finding, here we see difference between for 4 different treatments between the control group on the left and the treatment group on the right. And we see that for all treatments, there is a decrease in support for President Zelensky, but it is only significant for the what we call nation prime, for our people prime on the chart on the left. So we see this this 1 prime as kind of most significant result, but as I mentioned, instead of rallying around the president, people or around the flag and as the president as a symbol of the nation under that flag, people actually withhold support. So this prime, instead of boosting, dampen support for the president. So let's look at potential identity division. So let's ask if the nation primes effect driven by ethnocultural division, and our answer is no. Ukrainian main ethnic and linguistic group responds to the COVID threat by withholding support for president. So we have 4 measures of identity here. Ukrainian, language in which the survey was taken is the Ukrainian or Russian language of private life, native language as self-declared by respondent, and nationality. Traditional inherited from the Soviet times measure of ethnicity, which is now a kind of ethnicity slash national identity, as research shows. So in each of these figures, charts, on the left you see you see people who do not have this Ukrainian characteristic of language or nationality, or at the right who do have. So you see for both parts, is a 0 or 1, you have this significant effect. So there is no difference between those who have, for example, Ukrainian as their native language and those who do not, basically who have Russian as their native language, or those who have Ukrainian nationality and Russian nationality. So they respond similarly to this prime. So in this way, Ukrainians of both Ukrainian and Russian ethnic and linguistic groups are united in their response. So what about the 3 other primes? We see there are too many charts, so I will not discuss all of them separately, but we see that there are no identity divisions either. So by the same measures, language of the survey, language of private life, native language, and nationality, you don't have significant differences between those who do have Ukrainian language or ethnicity and those who do not. We found one significant difference, which is regional. Zelensky home region, southeastern Ukraine, is less harsh on him. So respondents from that southeastern region do not withhold support statistically significant in response to the prime. You see these pictures for performance prime, for personal prime, or for economy prime. Remarkably, for nation prime, there is no difference between southeast and the rest of Ukraine, meaning west and center, which is kind of makes sense that if you specifically activate cognition in national terms, so urge people to think of COVID as a threat to the nation as a whole, then this difference between one region and the rest of Ukraine disappears. So in conclusion, we establish that when framed as a threat to nation, pandemics can act as what we call reverse rally events. So rather than uniting in support, people are united in withholding support for the incumbent. We didn't find any significant differences according to identity measures we used, and we use as many as 4 measures of ethno-linguistic or ethno-national identity in Ukraine. So we can tentatively conclude that fears that pandemics inflame identity divisions might be exaggerated. And additionally, we established that there is a regional division, the home region effect. Support for a guy from our kind of home part of the country can be no less important than ethno-linguistic differences. So thank you for your attention. I look forward to your questions.
Thank you so much, Volodymyr, for your presentation. Oh, sorry, I hear myself in the background. Before we open the floor for questions from the audience, and questions are arriving now in the box, I would like also to give you the floor to ask questions between panelists. I know Sarah has some questions for Pauline and Henry. Sarah, would you like to formulate them?
Sure. So for Henry's paper, I was wondering if you could talk more about who's in the fear the virus and don't fear the virus groups, because I'm wondering if the don't fear the virus group in Russia is really small, or where they are, or no, the other way around. The fear the virus group in Russia might be really small, and where it is, and if this tracks onto an urban-rural divide, right? So that people in maybe people in Moscow and St. Petersburg fear the virus and have a sort of a different assessment. Or maybe not, maybe it breaks down another way, but I was just really curious to hear more about those groups. And I have a question for Pauline too, but I can stop there for now.
Henry?
I mean, what I can say right now, I was trying to look up. Can you hear me? Yeah. Yeah, if I have a minute, I can look up the figures on kind of how the breakdown is, in terms of the percentages. But what I can say is the results pretty much control for all of those things. So I find that the fear of the virus is having an effect, independently of, socioeconomic status, income, age, different factors that might be related to the virus, to the type of policy that the region has, implemented, to the severity of the crisis, at least the death rates, I mean, granted, as reported, to the extent we can understand them. So, I find that it doesn't seem to be picking up any of these things, and it's held up, pretty strongly. But I'll have to give you a precise, I don't want to give you an imprecise percentage, but if you give me a minute, maybe after Pauline talks, I can come back and just get you the specific figures on the distribution.
I mean, I'm not worried the results don't hold. I'm just curious what it means for regime survival, right? Like who are those groups, right? Like I'm not really worried about the result holding, but yeah, I just think it would be interesting to know too, in Russia, who is it that's concerned about the virus, right? Because there seems to be a lot of skepticism, anecdotally, that it's really.
Yeah, I mean, maybe just in response to that, I mean, I'd say, yeah, I mean, that's something that, I think would be a really great topic for a future study. I haven't, unfortunately, been able to get funding to do another wave of it, where I'd love to unpack that, right? I mean, I would imagine it's probably linked to some of the personality factors that, people like Graham Robertson and Sam Green have analyzed in some of their work, which they find kind of politically salient. So I'd imagine there's something to do with that. But I think in the broader context, it is very interesting that these kinds of dispositions, kind of tendency to be fearful, not fearful, other things which probably are related to the pandemic are, they're also related to like partisanship in the United States, right? And kind of have impacts on how people respond to the crisis, but also how they respond to cues coming from leadership and parties. So, basically, I don't have any specific answers other than what I can look at in terms of correlates here. But I definitely think that would be a great topic for the future.
Thank you, Henry. Now, so questions are arriving, so I would like to ask you several questions. Pauline, there was a question about the issue of self-reporting high confidence in Kazakhstan. I mean, how do you treat that, knowing that we are in an authoritarian context? So how do you trust the self-reported high confidence in the president in the Kazakh case? I think that's a regular question that we have for authoritarian context. Volodymyr, there was a question that in kind of parallel what we were discussing about Russia on the fact on how Zelensky tried to shift responsibilities and blame on the regional governor. And if he did that, was it a successful strategy? And then Sarah, that's also something that you mentioned at the end of your presentation and that Henry came back on it. But if you could develop on your current research, where do you see any differences in approval of the federal and regional authorities, if you could come back on that? So that's a kind of broad set of questions. Maybe Pauline, would you like to begin? And then while each of you are responding, I will be collecting a second round of questions.
Sure. Yeah, no, that's a great question. It's a totally fair question. We always have this problem in survey research with self-reporting in general, but particularly in an authoritarian context, we don't necessarily expect people to be fully free, I guess, to be, let's see, honest or forthright, particularly if their opinion is negative. The way we kind of hedge against this is to ask a variety of questions, right? So, one thing that gives me confidence in the confidence results for Kazakhstanis and the president is that they were willing to say they didn't have confidence in other institutions, or they had less confidence, right? So they were willing to say they had lower levels of confidence in their local governments, in the national parliament, right? So it doesn't seem like it had a total chilling effect on their ability to say that they had less confidence in other important institutions. We also asked other questions, for example, about most trusted sources of information when it came to the coronavirus. And one of the options, so they got to rank their top 3, and nobody put the president in those top 3. So we have a sense that they're willing, when they're asked a kind of a more general question, not to necessarily flag the president as being confident as or trusted as a source of information. But the top 3 for Kazakhstan were friends and family, social media, and then Kazakhstani TV and news. Those are the top 3. And also we asked questions about general trust, and we asked about trust in politicians, scientists, medical professionals, and religious leaders, sort of a variety of more amorphous as opposed to specific individuals. And politicians, there was pretty modest trust in politicians in comparison to medical practitioners, for example. Finally, we asked a question about support for parties. So there was a sort of opportunity to, if it was truly about, I guess, the president, to show strong support for the presidential party, and we didn't see strong support there. So it's just sort of asking a variety of questions and trying to see if respondents are generally being, it seems they're reporting their opinion honestly, as opposed to they're feeling that they have to choose a particular response.
Thank you. Sarah?
Yeah, so I think that's a really good question about the difference in federal and regional approval. And I think Henry has a better answer than I do. I don't know, because the approval data that I showed in my presentation is just published Levada survey results. And so it actually shows slightly higher, if you're looking at aggregate, it shows slightly higher approval for Putin than the regional governors. But then if you look, they do break it down in the published results in the urban-rural divide, and they show the urban areas are more critical and the rural areas are more approving of Putin. But so I think that's a really important question that I don't have a good answer to. And then there's a question for me from Judy Twig in the chat, who's asking, how is your survey worded to differentiate between quality of healthcare and quality of polyclinics? So we had a grid question that listed categories that said, do you think the government's providing adequate services in these different areas? And one was healthcare broadly, and one was the polyclinics specifically. Yeah.
Great. Thank you, Sarah. Henry.
Was there one directly for me, or?
Yes, I think so. Let me.
I think I just added one.
Sorry,
Yeah.
Shall I ask it in person?
Yeah, go ahead. Sorry, yeah.
Okay.
Yeah, please.
No, I just wondered how much of the story that you're telling is really about delegating responsibility, which Putin clearly tried to do, but as you yourself show, is that people are confused about those kinds of messages, or is it, can you somehow establish, is it in quotation marks simply an effect that in this crisis, people are more aware of what's happening at the local and regional level because they need to access sort of the health services and so on. So whether this connection to really, I mean, on one level, you could say Putin's strategy paid off. He delegated and then all his governors got re-elected. So in some ways at that level, it seemed to have worked. But is it really the dynamic about sort of this, that he delegated it, or is it really it's coming from below? It's what happens is that you notice more what's happening locally and regionally.
Yeah, I mean, I think that's a great question. Kind of having been in Moscow throughout the pandemic, I could say certainly what your mayor is telling you, you can do or not do, right, or your regional head, has a lot of impact on your daily life. But at the same time, I think it matters a lot this is just my impression. I think it's a great topic again for future investigation, but kind of whether people perceive that they are carrying out somebody's orders from the top, or whether or not this is their actual policy. And I think, at least in the case of Russia, there's definitely a sense that the governors and the mayors had a lot of autonomy to decide things. They weren't just implementing orders from the Kremlin. I mean, Sobyanin and the mayor of Moscow, was regarded, during a lot of the period early on the crisis as having kind of a more strict, a tougher position on the virus than Putin, and seen as almost kind of a counterweight to Putin's more lax national approach. At least, like as Sarah described, that lasted only up until a point, until June, where Sobyanin kind of almost reversed course and started relaxing. So, my sense is it's both. The fact that the local officials affect your life, but I think that kind of in the Russian context, it is important that that there is this very explicit message that the regional authorities are going to be the ones in charge. So I think that affects how the policies get communicated to people below, in the different regions, and therefore translates back to their who they reward and punish.
Yeah, thanks.
Thank you, Henry. Volodymyr.
The situation in Ukraine differs from that in Russia by one crucial factor. We have local elections this fall, so just a bit more than a month from now. And so as the election nears, the kind of tug of war between the central and local level becomes more and more kind of obvious, and the stakes grow higher. But initially in the spring, at the time of our survey, there was a nationally imposed lockdown, and of course the responsibility for implementing decisions on restriction of activities was local and regional, but the decisions themselves were made nationally. So the strict lockdown was implemented very early, one might say too early, because of fear and uncertainty in mid-March, and everything went to standstill for a bit more than 2 months. No public transportation, and everything is closed except for stores and drugstores, and that's it. And there were some excesses in implementation, like police trying to chase people out of parks, and there was not much local variability at that time. But as time passed, there was impatience with this standstill. There was the kind of wish for renewed activities. There was realization that such a strict lockdown harms the economy and people's everyday lives, and there were some local attempts to reintroduce some semblance of normality ahead of national decisions, and the national government started to fight back, threatening with criminal prosecution of those local officials, notably in Cherkasy in central Ukraine. But then one by one, local mayors realized that such a war, such a confrontation with the central government is actually beneficial to them, because they can present themselves as standing for the local community. And so as time went, as national lockdowns was relaxed, but then with the spikes of new cases, when the government tried to reestablish some local limitations by dividing Ukraine into different zones, those designated as the most dangerous zones, red zones, started to fight back. They didn't want to comply with a national decision, or, for example, banning of public transportation, or prohibition to reopen schools and so on. So now it's more about elections than anything. Ben, you want to add anything?
I just wanted to say simply aggregate levels of support were already, when we did the survey, higher at the local level than for Zelensky at the national level. But we're now, it's the next step. We're going to probe more what's happening at the local level now in the run up to the elections. So we're repeating the survey and the experiment, and maybe we can bring it back to this group again at a later stage.
Great, thank you so much for your answer. Let's go for a second round of question, and maybe let's go in reverse order this time. Volodymyr and Gwendolyn, a question about how the Ukrainian public opinion reacted to the current crisis in relationship to the Donbass situation, how the Ukrainian public opinion has been discussing the fact that COVID-19 has been really hurting a lot in the Donbass region, given their status and the difficulties to have functional healthcare system. So did that kind of renew the general public opinion discussion around the situation in Donetsk and Lugansk? Henry, a question about the parallel with the reaction of Russia to the sanction and counter-sanction after 2014. So the fact that some people were harsh on Putin's decision in the name of the kind of economic situation of Russia. So if you could develop your conclusion on the relationship between the factor of fear and the way people perceive the general economic situation. Sarah, there was a question about how perception among Russians, are there perceptions, among Russians that Putin reversed COVID restriction prematurely in order to have the referendum on constitutional reform passed in July? So how is the relationship between the pandemics and the referendum discussed in the public opinion? And Pauline, there was a question asking you, sorry, I need to move it early, asking you to interpret your survey results as showing that pre-existing confidence and trust are a primary determinant of confidence in the state response to a crisis. So if you could develop on that kind of pre-existing confidence and trust in the front of an unexpected crisis. So let's go in reverse order. Volodymyr and Gwendolyn.
Shall I make a start, Valoria? We didn't ask a specific question on the war. We're going to do this in the next round, because we asked ourselves exactly that question, not only in general about views on the war and that things are not improving and rather getting worse in the war zone, but also to probe this factor that we highlighted, that the Southeast, without the nation prime, still sees Zelensky more positively. So we also think that perceptions of the war could have an effect here. So we want to ask that in the next round. But we did ask a related question, and we asked about trade-offs. In terms of a trade-off in priorities between the economy and fighting the virus, and a bit like what Henry presented for Russia, but also a trade-off, a potential trade-off between territorial integrity and security as a priority versus the virus. And we found that 26% said they would prioritize territorial integrity and security issues. Presumably that is primarily related to the war. And we found that region was an important factor in that, and that Western regions were more likely to prioritize security. But this is something to be probed more in more detail.
Volodymyr, would you like to add something?
Yes, in addition to this kind of survey based data, I can add that much of kind of public activity and communicative activity this past months has been about Zelensky perceived intention to kind of quote unquote betray Ukraine. Yeah, so to take some steps that would that would be supposedly oriented toward ending the war, but in fact would sacrifice too much of Ukraine's territorial integrity. There have been repeated rallies downtown next to the presidential administration and so on. So more which part of society, civil society, the pro-Maidan part of society, Western-oriented society, there is much suspicion that using this COVID restrictions as an excuse, the government can take some steps while civil society is dormant, so to say, unable to respond vehemently. The government can take some steps which would be very detrimental to national security and to protection of Ukraine's interests in the Donbass. So there is much controversy about that.
Thank you both. Henry?
Yeah, I mean, this question about the comparison with Crimea is very interesting, and this is one of the reasons that one of the factors that got me interested in this, because for a number of years now I've been working on issues related to rally effects, in part focused around the impact of the Crimea annexation on political behavior in Ukraine. And I think you're right. I think, the premise of the question seems to be right, that like in both cases, we do find that the economic consequences of the event, right, the pandemic or the Crimea annexation, were implicitly understood to be negative and hurt the regime. But the main difference is, I think, that there's really no aspect of the pandemic that seems to be generating any kind of rally for Putin. Instead, the effects are on balance negative. And so it's not so much that well, I guess I'd say, like in the case of Crimea, there's a big rally effect. I mean, we could talk about, I think kind of the way that it's been understood is sometimes not entirely correct, but there was a significant bump in approval for Putin after Crimea. And that is dampened by, when someone raises economic concerns. I know, among others, like Maria Snegovaya has, written some interesting things on this, but I found that in my own research as well. But the big difference is that for the pandemic, there just isn't that positive. It's not that the economic considerations are limiting or kind of constraining the rally effect. They're actually kind of having a negative impact on public opinion in Russia. So it's something similar, but the positives just aren't there for the pandemic. Whereas for the whereas for Crimea, there were positives for Putin politically.
Thank you, Sarah.
Yeah, so Judy Twiggett had the question that I see in the chat too about if there's perceptions among Russians that Putin reversed COVID restrictions prematurely to get through the referendum on constitutional reform. And the answer is I don't really know. I think that probably some Russians do think that, and that it probably breaks down along the lines of Russians that were already more inclined to maybe be critical of Putin, think that he maybe did that. But my guess is that even if they think he did that, they don't really care, or that's kind of not the critical part of his approval rating. Like, even if they think he lifted it prematurely for that, it would really depend on if you're worried about the virus or not. And so I think it goes along with what Henry's been saying about there's other reasons that Putin his approval rating declined. And I suspect that a lot of Russians care more about the general economic and living conditions, and they're less primarily concerned about COVID, is my guess. That's why I'm curious how big that group of people is who really fear COVID in Russia. But yeah, I mean, the answer is really that I don't know, but I suspect that a bunch of people do think that, and a minority maybe care that he prematurely lifted or encouraged the premature lifting of restrictions for that, and that many might think he did, but don't really care for his approval rating that he did that or not. Yeah.
Actually, can I just intervene just with the shares, because I did find those data just because it's kind of on point. And so, at least in the April Levada survey, what I found was that, basically it was a 4-point scale. And it was only 20% that said they didn't fear it at all, but there was another 22% that definitely minimized it, right, saying they weren't very afraid. But 32% said that it was something that they feared somewhat, and 27% said that they were quite fearful of it. I need to go back and check to make sure those figures are with the proper weight, so I just haven't done that analysis yet. But that's the basic, so he was talking, at least as of late April, a substantial share of people. I mean, it's roughly a split population, right? It's not exactly half and half, but roughly split between the fearful and unfearful.
Thank you so much, Henry. Pauline?
Yeah, thank you for that question. So intuitively, that pre-existing trust and confidence is going to have on trust and confidence during a crisis. The problem is we don't really know what kind of effect it's going to have, right? And what are going to be the sort of that's one. I would say, pre-existing confidence and trust, if it's high, could lead to rally the flag. It also could lead to disappointment. And I think an important sort of intervening variable there is, what is the actual policy response? If you have high levels of confidence and trust and you have a policy response, that might give you a boost, but you have a not so great policy response that might, push trust and confidence in the opposite direction, right? So intuitively, we're not sure about the direction or the mechanisms. I think policy response matters a lot. What's really interesting about Kazakhstan and Kyrgyzstan, as I mentioned very briefly at the beginning of my presentation, is they did enact very similar policy responses. I haven't gotten into the behavioral aspects yet of analyzing the survey in terms of the degree to which people comply, or at least self-report their compliance with the policies, which I think is going to be really. But they did enact similar policies in terms of both the scope, right? They also similarly relaxed these policies led to, as before, the spikes in the number of cases. So you can almost not purely hold, the crisis response constant, but you can say it's pretty similar. And so it may be this effect. If we can get Kazakhstan confidence and trust were higher at the beginning, in Kyrgyzstan they were lower. The problem is we don't have that baseline data. We don't have Levada surveys in Kazakhstan and Kyrgyzstan, these ongoing surveys that give us that baseline. Kazakhstan, I did a survey in Kyrgyzstan in 2018, so I do have baseline trust data prior to the crisis, but I don't have it for Kazakhstan. What I can say is that general level, this crisis, general levels of trust do affect confident trust in the handling of the crisis, if you can tease those two things out. Because we ask questions about just generally how much do you trust the following groups of people or individuals, and then how much confidence you have in their handling of the coronavirus. So those questions are asked separately, but in survey. So.
Thank you so much. Now we have only 10 minutes left. So if there are questions you would like to ask to each other, I would welcome that. Otherwise, I have a kind of broad general question for all of you. So are there any question you would like to? Yes, Henry.
Yeah, I just have a question for Pauline. I mean, these are really interesting results. And I guess, I mean, I may have missed something, that you've kind of already said, but I wonder, are these like kind of differences in regime type somehow? I mean, I'd have to think through that more to see whether that even makes sense. But, in Kazakhstan and Kyrgyzstan, kind of the differences in, beliefs about, the real state of affairs and, the faith in the regime to be able to kind of have a unified, coherent response. On the face of it, I was wondering if this is kind of an authoritarianism, versus kind of, more politically closed, more politically open kind of a difference. So I wondered if you've thought about that. I'd just be interested in hearing more of your thoughts on that.
Should I answer now or wait for questions? Yeah, answer.
No, please answer.
Okay.
Answer now.
So, I mean, I think it's one of I kind of wanted to look at two different regime types to see if there would be variation in the outcome. And I think regime type does play a role, but so does, state capacity or perceived state capacity, levels of state capacity. I think it's interesting. I was thinking about both your and Sarah's presentations and this notion of expectations and what are the expectations. It might be that because of low state capacity in Kyrgyzstan, there's already lower expectations, right? But then that would lead to kind of maybe a boost in confidence because Kyrgyzstan did better than they expected, right? And it doesn't. So I think the differences in regime type could be affecting this in two ways. One, could be the conflation of the regime type and the capacity. And I think a lot of literature does that. Authoritarian regimes are more capacious when it comes to, administering these or resolving these crises because they can enforce policies, even though I'm not sure we see that on the ground. And the second way is, goes back to the first question I was asked about responses. So are Kazakhstanis saying they're more confident because they don't feel free to say that they're not confident, right? And so the rally around the effect, the rally around the flag effect, has rally around the regime, and so that's something I think I need to explore more.
Thank you. Are there any other questions you would like to ask to each other? Okay, otherwise I have, so in fact, a broad question to all of you that is in fact continuing the discussion that just began between Henry and Pauline, that the title of our panel is about regime legitimacy, right? And we are all at the same time citizens. I mean, Volodymyr is in Ukraine, but all of the other speakers are citizens either of the US or European countries, and we are both experiencing the pandemics also as citizens and not only studying as scholars. So what does that tell us in terms of the way we want to compare, right, our Eurasia region and what we are living in Europe or in the US? I mean, are there really, where are the real specificities, or are there any kind of specificities that we see in that Eurasia region, or how do we want to build the comparison, knowing that state capacity has also been challenged in the US and in Europe, and that we don't use the term regime legitimacy to speak on Western European public opinion relationship to their political authorities, but you also have kind of challenges that are visible in the US or in Europe. So if you could give you the floor very, very briefly, each of you or some of you, for some kind of final comments on what that tells us as comparatists doing political science in a comparative way. What does that tell us about the place of our region, or the way we have to be more comparative maybe in approaching our region? Who would like to begin? It's a tough, kind of very broad question, and we only have 5 minutes left. Volodymyr.
So as one non-Western here on the panel, I would say that in Ukraine we have a specific combination of a general post-Soviet tendency of distrust in authorities. So we citizens treat with suspicions almost anything our authorities do. We suspect them of being corrupt, of being incompetent, of selfish and sometimes simply stupid. But on the other hand, we Ukrainians experienced this landslide victory of Zelensky just a year ago. So he was at the beginning of the pandemic and partly remains the most popular politician and supported by many people no matter what. But the combination of these two factors actually brought in a combination of these two factors, the pandemic brought him his unique phenomenon to more or less normal post-Soviet treatment of politicians. He became just another politician, more or less, demonstrating his incompetence and his lack of care for people and so on. For many people, this was just a confirmation that he is no better, and the declining rates of support for Zelensky that various surveys even during these pandemic months confirm that.
Thank you, Volodymyr. Who would like to comment on that? Sarah.
So I've thought a lot about this in comparison of the US and Russia, and that I think both countries are failing, but for different reasons. And so Russia's got sort of an authoritarian failure, and the US has kind of a democratic failure, or if we want to be a more skeptical, maybe a declining democracy failing. But Russia, it seems to me, is failing because they both can't, they lack the infrastructure and the motivation to respond in a better way to the COVID-19 pandemic. And in the US, I think there's a failure because of political polarization and federalism. And so, I might be wrong on that. I mean, I'm making a big, broad, sweeping characterization of a comparison of the two, but it strikes me that Russia's a kind of authoritarian failure in response, and the US is a kind of democratic failure in response, perhaps because of really high political polarization. And there's other work that shows polarized democracies have a lot of problems when there's really high political polarization and you have a democratic system. There's all kinds of things you can't do. And one of them is you can't respond to a crisis, right? And in Russia, they don't have high political polarization, but there's a different reason. And it's maybe more complicated too, in that there's this cynicism about if COVID's a real threat. But as Henry pointed out, I mean, it's like 50% of the population is worried about the COVID-19 virus. So it's not like Russians don't believe it's happening. Yeah, I'll stop there then.
Thank you, Sarah. Great.
Can I jump in? Can I jump in, Marlon?
Of course.
I think it follows well on what Sarah was saying. I think it's less about regime legitimacy than it is about crisis of leadership or legitimacy of leadership, and maybe that's a misnomer to say regime legitimacy. I think a lot of the focus is on the ability of leaders like those we have in the United States to competently address the crisis, and part of it's the polarization, right? But part of it's their sort of underlying belief system, right, about the value of certain kinds of centralized institutions and strategies. And what we found as I mentioned, this is a part of a 20-country study. What we found is that the real crisis in legitimacy is not so much at the domestic level, but at the international level. So like Kazakhstan and Kyrgyzstan, people have very low levels of confidence and trust in Chinese leadership across the board. US leadership in particular is at an all-time low in terms of people's trust and confidence in the US. But on the flip side, the good news is international organizations like the WHO seem to be, highly trusted, and there's lots of confidence in the WHO across the board, at least across the 20 countries that we look at. So that consistency is nice. So again, I think it's really about leaders and less about institutions or regimes.
Thank you. Great comment. Yeah. Henry, the final word to you.
Yeah, I'll follow that up. And yeah, I agree with Pauline. I think it is a lot more about leadership. I mean, I think kind of just in terms of, I've also been interested in this issue of comparisons with the US. I think one general conclusion seems to be that pandemics are a negative generally. It's just very difficult for any national leader to handle, especially over time. A few have managed, but it doesn't seem, they maybe at certain periods of time, but I think that'll be one of the questions kind of over the long run. Can any leader really manage this effectively? Because there are a lot of downsides. Presidents in both the U.S. and Russia seem to have been harmed politically, just from a political standpoint, by trying to delegate authority to regional leaders and kind of try to avoid taking a strong national position. And regional leaders tend to benefit, whether it's governors like, Cuomo in New York, or Sobyanin in Moscow. Although I think that the effect actually is more mixed in the United States. I think maybe just to bring the Ukraine thing back in, my sense is there's actually more unity than difference, in terms of the effect of how this is playing out, because I think the effect of kind of bringing people together in Ukraine kind of against the regime is actually not that different in the United States, because while a lot of people have noted that, there are big partisan divides and everything from like mask wearing to, to just, views on trade, right, that seem linked to Trump. On the other hand, there's been research showed that there are big partisan differences in behavior, including health differences, completely independently of, what their parties are telling them or what parties politicize, whether like goes back, like research from over a decade ago on like flu vaccines and stuff like that finds Republicans are less likely to do that for other reasons having to do with, I think, cognitive styles, personality traits that tend to be correlated with politics. So, you know, I'll just leave it there. But I think these are all great questions to be studied. It's a really interesting field.
Well, great. Thank you so much. It was really a wonderful seminar, and it's great to see ongoing research on such an important topic on different regions of Eurasia. So I would like to thank all our speakers, our audience, and remind you that we are continuing our discussion next Friday, 10 a.m. Eastern time, where we'll have another panel continuing to look at different aspects of politics and security in Eurasia. So once again, thank you everybody, and great research on its way, ongoing research. Thank you everybody.
Thank
Bye-bye.
you.
Bye-bye.